MedJ, MedB and MedL are new devices with a modern ergonomic design and technology that meets all operator needs and preferences when performing bone marrow biopsy and aspiration. MedJ offers precision and comfort during the biopsy procedure. The lightweight handle design enables the operator to apply the proper pressure for easy entry into the bone. A cap stylet integrated system makes the device stable during penetration. The tapered cutting cannula can cut and collect the specimen properly with minimal damage to the tissue architecture. The additional cap minimizes hand trauma when harvesting the marrow sample. The comfortable ergonomic handle in MedB minimizes hand discomfort. An additional cap reduces hand trauma during penetration into the bone marrow. For a more advanced level product, MedL combines a comfortable ergonomic handle with a separate extraction cannula aimed at improving the quality and quantity of harvested specimens, while avoiding the deflection technique, which is painful to the patient. Two different extraction cannula shapes are combined with unique cannula tips to maximize performance and to accommodate different clinical preferences. The MedL pincer version can be used to harvest and retain the specimen between two thin metal pincers, which partially close the end of the tapered cutting cannula. Pincers gently embrace the specimen with minimal crush artifact. Specimen is easily detached from its base by rotating the whole system, external cannula and internal pincer device, before removal of the patient's marrow. The MedL scoop version is intended to harvest specimen within a specifically designed extraction cannula with minimal damage to the marrow architecture. The scoop extraction cannula can be rotated inside the cutting cannula and removed separately with specimen retained within. If needed, the cutting cannula can be repositioned within the patient and the scoop extraction cannula reinserted to harvest an additional specimen. Alternatively, rotation of the complete system without removing the scoop extraction cannula will detach the specimen from its base for collection and retrieval from the patient's marrow. MedJ, MedB and MedL versions are all suitable for bone marrow aspiration if required, in addition to biopsy. Prior to collecting the specimen, an appropriate syringe can be connected to the cannula handle to aspirate the desired quantity of liquid. Bone marrow and aspiration biopsy systems are available in different gauges, from 8G to 13G, and different lengths, from 70 to 150 millimeters. Biopsy procedures using MedJ or MedB are performed in a similar way. Hold the needle firmly to insert through the cortical bone at the posterior iliac crest. Rotate clockwise and counterclockwise during penetration. When the marrow cavity is accessed, stop penetration and remove the internal stylet from the outer cannula. Move the cannula forward into the marrow, rotating it clockwise and counterclockwise to entrap the specimen. Detach the specimen from its base by rotating the entire cannula stylet assembly 360 degrees to the right and then to the left. Or slightly pull back the cannula stylet and deflect in any direction to detach the specimen. Slowly remove from the patient while gently oscillating the needle cannula. Placing the safety accessory over the sharp end of the cannula will prevent accidental puncture of the hand while pushing the blunt probe from point to hub to retrieve the specimen. The MedL cannula stylet assembly is pushed through the cortical bone. The trocar stylet is removed when the bone marrow is accessed. The cannula is moved deeper into the marrow to encase the sample within the cannula. Push the extraction cannula, either scoop or pincer, slowly but completely into the outer cannula. When using the Medax pincer version, the complete system, outer cannula and extraction cannula, is rotated to detach the sample from its base and collect the specimen. The Medax scoop version gives two options to collect and retrieve the specimen. One choice, rotate and pull back the complete system, cannula and extraction cannula, the same as the pincer version. Alternative choice, rotate the extraction cannula only and remove it from the cutting cannula, which allows for multiple biopsies. After detachment and collection of the specimen, the Medax scoop version can be removed from the patient by slowly oscillating the cannula-extraction cannula assembly while removing from the patient. Specimen is retrieved by pushing the blunt probe through the hub end of either extraction cannula.